It's a really good question, Isabella. It's a challenge still. What I do personally, I try to like have I mean, there are organizations to start off. Let me say that, like, there is something called Care Access, and they would be able to help with that if they get approved. But I've not had one single patient that has been successful through that program because it's a process. Like, you have to download a form, you have to fill that form and send it, and most of my patients don't do that. So in our hospital, it's been a challenge too in clinics. What I do, I try to gather the surplus that other patients get, like those with insurance, and then I store it, and then we just give it to some of those who cannot. There are issues with compliance with that, but I just tell them that you can get it from my trunk in the parking lot, then from my office. So you can read between these lines what I said. But that's how we are dealing with it. But there's also complex care case management in the hospital. They try to help with other things like transportation, or there is a family access program, or financial assistance program, FAP, and they try to see if their income is below a certain level, they will get into that, and then they will try to help through that hospital insurance program that's called FAP. So that's another avenue for them to do. So these are there, but still, like I said, like, there's a majority of patients who cannot just afford any of this. There is a hole which is not being addressed with any of these tools in place.